What's your understanding of what the body normally does in a healthy person when HA filler is injected into them? Is there any reaction at all? Because we're told by the pharma companies these are non-toxic, non-immunogenic, they're totally fine, they're benign. But what does your research tell you?
What the pharmaceutical companies, if they have said these specific words to you, that's BS.
What's your understanding of what the body normally does in a healthy person when HA filler is injected into them? Is there any reaction at all? Because we're told by the pharma companies these are non-toxic, non-immunogenic, they're totally fine, they're benign. But what does your research tell you?
What the pharmaceutical companies, if they have said these specific words to you, that's BS. So looking at the facts is that when a foreign body is injected inside the body, you always got or will get an early onset immune response.
Yeah.
So that's what's supposed to happen. So macrophage, they attack the foreign body, and that always happens. So a little bit of redness and swelling, and you feel that it's hardened in the first few days. That's how it's supposed to go.
Yeah,
that's logical.
No, I agree. And that's why I certainly tell my patients, not you might get swelling, you are going to get swelling. And if you can't handle that because of work, or your husband's going to shout at you for having something done behind his back, then don't do it, because you can't hide it. It's going to be there.
And it's okay, yeah?
Yeah.
Be happy that your immune system responds to foreign body.
Yeah, you're alive.
I always, no, but for real, my friend. So I'm that enthusiastic, always smiling, but also scientist doctor. So I tell them the facts, and I bring it in a happy place way. And since it's the truth, you don't have to hide it.
Yeah, absolutely.
And then if it happens to the patient, she knows that, oh yes, Dr. Sloan, she told me that he told me that this was going to happen.
Yeah.
Perfect.
Yeah. And so what's the next stage of the process? So you initially elicit an immune response, which we've just agreed is normal and healthy and indicates that your body's working as it should. So what happens after that in terms of how it integrates into the tissue? That word integrate, you hear sort of said a lot, but in terms of what does that actually mean? And then what happens to the immune system after that initial period has passed and that swelling goes down and it seems to, I guess, almost acclimate to your body?
Yeah. So when it's injected inside the body, then the macrophage, they come and you have an early onset immune response. And then it sees that most of it is HA filler, and that's body friendly. And in some patients, the immune system goes berserk. And in time, some weeks, some in months, you get a late onset immune response. Yeah. And that's when the problem happens. And then nodules can happen. And then you can also get redness, swelling, inflammation. And we now know a little bit better why that happens. And that's in my thesis.
Yeah. We'll come on to the lumps and sort of bad stuff in a sec. But, when the pharma companies use this word integration, like David mentioned, I was always led to believe, that I got shown some histology slides, and it almost looks like little blobs of filler have mixed in with, the body's tissues, almost like a hybrid, and everything's living happily together. But is that real? Do you see that in your own?
Yeah, but that's that part I agree on.
Right.
So
but isn't that like, that would be more if you had fanned through a thin layer, say in the subcutaneous layer. But if you do a big blob bolus down onto the periosteum, presumably that has less chance of integrating.
But that's what also the purpose is of that large blob.
Yes.
You want to give volume, and it's degraded slowlier, so
Yeah.
you have a longer period of time that you can enjoy it.
Yeah. I got I've had filler before, shock horror.
You haven't, no?
Yes. And I got a flu one day, and my face swelled up. I looked like I'd stuck my face in a wasp hive, or I looked like the Elephant Man. What's going on there? Why does that happen? I know it's only happened once.
Your immune system works. Good for you.
Right, but why then? Why at that point? What's it got to do with the cold, and why hasn't it happened since? It was just this aberration.
I think adverse events are a multi-factor disease. So you went to the city center with Jack, and you had a lot of beer. You slept not much that evening or that day. You had a lot of stress at work. Then you got the flu, and your immune system says, oh, there's now a threshold that we reached. Bomb! Let's fight with all our macrophages and T cells to the product that should not be there, the foreign body material.
Yeah.
Right.
I mean, I was actually going to ask that question later. Yeah. No, I just wanted to continue on sort of normal patient first before we get into complication, because, you know, so we've done our blob of filler down onto the periosteum, and then at some point it's going to hydrolyze and break down. So
correct.
We're led to believe, and I remember Professor Goodman, I think even maybe on our own podcast, he told us that the theory is that when the smaller chains or the low molecular weight chains of HA break down, these things are just innately inflammatory. That's just the nature of them. And so as your filler breaks down, naturally, there's a little bit of a stimulus or a signal to your immune system. Is that true?
Yeah. I highly respect Professor Goodman, and I think that partly it's true. He's saying that, the way he's saying that, with a very, and he knows, a very thin layer of evidence. What I can say to you here is that we're going to continue doing our research. Yeah. We know that those low molecular weight HA filler are inflammatory. We know that. But why does it in one person shifts between those low and high and gives an inflammatory reaction, and in others it doesn't? We don't know yet. Aesthetic medicine, or cosmetic medicine, how do you want to call it, hasn't been there for 25 years something. So looking at cardiology, who's been there for decades and hundreds of years, their research is way beyond us. Yeah. So in time we will get there, and I can answer this. But this is one of my new researches, that we will dive into low and high molecular weight, and also type M1 and M2 make macrophages, and what happens over time. So when we have this same podcast in a few years, and you're on national television, and then we talk about it.
Yeah, I mean, one of the confusing things is even between the companies, what they call low molecular weight and high molecular weight is completely different.
True that, but my friend, but as Aristotle said, the more I read, the less I know. So I dived into everything, and I really got a headache. And after this podcast, with all the knowledge you have, and the new things I said to you, you also will think, oh, but that I didn't know that, and I want to dive into that. And when you dive into it, you think, what the FUCK is this? So more and more knowledge, and that's also the reason why I'm in all those podcasts all around the world, television programs, hoping to stimulate even younger persons than me to also start doing researches. Question my research, please dive into it. I tried to understand genetics, the immune system, bacteria, everything, but I know very less. But since many people in our line of business don't know anything, we know quite a lot, but we still don't know anything.
That's a really refreshing perspective, because I think in any of these sort of academic pursuits, whether it be medicine, archaeology, like anything where you've got egos, you've got people that are doing research, there's dogma, people become emotionally attached to their ideas, their findings, and the prospect of having it challenged or having to walk something back or admit that they made a mistake or there is an error can sometimes can halt progress, because people don't want to be proven wrong. They don't want to have to say that something was incorrect. So it's very refreshing, just as an observation, to hear someone of your status say, please challenge me, ask the questions. Maybe I'm wrong. This is something we need to do together. And I think it's a really refreshing and admirable quality. So thank you.
Thanks so much for watching the podcast clip. You can listen to the whole audio episode of the podcast on your favorite podcast app, on Apple Podcasts or Spotify. And please also leave us a review on the podcast app.
If you like what we do, please smash the like button, consider subscribing to the channel, and don't forget to hit the bell icon so that you get notified when we release new content.